Let me say something uncomfortable. Many doctors fail medical English exams like PLAB, OET, and AMC, not because their English is bad, but because they sound unsafe when they speak to patients. Too fast, too technical, too robotic. Today, I'll show you how successful doctors take history in English and the 10 mistakes that quietly destroy exam scores and patient trust. If your goal is to work abroad as a doctor, this video is essential. Part 1. What history taking really is. History taking is not a checklist, and it is definitely not interrogation. It is guided storytelling. The patient tells the story. You guide the direction. You clarify details. You organize the information. Examiners are listening for logical flow, patient-friendly language, safety awareness, professional empathy. Now, let's break down the 10 most important history-taking mistakes. Mistake number 1. Yes-no question overload. Wrong. Do you have pain? Is it severe? Is it constant? This shuts patients down. You get one-word answers. The story disappears. Correct. Open. Closed. Better. Can you tell me more about the pain? How would you describe it? Is it there all the time or does it come and go? Exam insight. Examiners expect open questions at the start, always. Mistake number 2. Poor pain descriptors. Wrong. Is the pain sharp? Is it burning? Many patients don't understand medical pain labels. Correct patient-centered phrasing. How would you describe the pain? For example, sharp, dull, burning, or something else. This shows clarification without pressure. Mistake number 3. Ignoring the timeline. Wrong. How long have you had this? Too simple, too shallow. Correct timeline building. When did it start? Did it begin suddenly or gradually? Has it been getting better, worse, or staying the same? Tip for C1 level language. Trajectory, duration. Mistake number 4. Forgetting functional impact. Pain is not just a sensation, it's a limitation. Wrong. Is it painful? Correct. How is this affecting your daily life? Are you able to work or exercise as usual? Has it affected your sleep? Examiners love this because it shows critical reasoning. Mistake number 5. Awkward, sensitive questions. Wrong. Do you smoke? Do you drink alcohol? This can sound rude or accusatory. Correct softening language. I need to ask a few personal questions. Is that okay? Do you smoke or drink alcohol at all? This signals consent and professionalism. Mistake number 6. Using medical jargon with patients. Wrong. Do you have any dyspnea? Palpitations? Syncope? That's not patient English. Correct. Have you noticed any shortness of breath? Have you ever had any episodes of your heart racing? Have you ever fainted or felt close to fainting? Rule: doctor-to-doctor English, not patient English. Mistake number 7. No structure signaling. Patients feel lost. Examiners feel uneasy. Correct structure signaling. I'll start by asking about your symptoms, then your medical history, and finally your medications. Structure is safety. Mistake number 8. Interrupting the patient. This is one of the most damaging habits. Doctors interrupt within seconds, especially under exam stress. Wrong behavior. Cutting the patient off, finishing their sentences, jumping to diagnosis. Correct approach. Let the patient speak for 30 to 60 seconds. Use gentle prompts. Go on. Tell me more. What happened next? Examiners interpret interruption as poor listening skills. Mistake number 9. Not checking patient understanding. Doctors often assume the patient understands. That's unsafe. Wrong. Giving explanations and moving on. Correct. Does that make sense so far? Is there anything I explained that's unclear? Do you have any questions about what we discussed? This shows patient safety awareness, a huge exam point. Mistake number 10. Not summarizing the history. This is one of the highest scoring exam behaviors, and many candidates forget it. Wrong, ending the history abruptly. Correct, summary. So, just to summarize, the pain started 2 weeks ago, it's a dull ache in your lower back, it worsens with movement, and it's affecting your sleep. Is that correct? This shows active listening, accuracy, professional confidence. Examiners love summaries. Perfect history-taking model, final. Listen to this flow. Can you tell me more about what's been bothering you? When did it start? How would you describe the pain? On a scale from 0 to 10, how severe is it? How is this affecting your daily life? So, just to summarize, is that correct? Thank you. That really helps me understand your situation. This is strong C1 level medical English. In the next video, we'll cover physical examination language, including how to give clear instructions, how to ask permission properly, and how to maintain patient dignity. Subscribe if your goal is to work abroad as a doctor. Comment below, which mistake do you recognize in yourself most? Follow for more Medical English Pro.